Bringing your newborn home is a beautiful moment, but it can also bring 100 new questions. How should you feed your baby? How can you make sleep safer? What about bathing, common health problems, vaccinations, and growth? In this complete newborn care guide, we'll take you through the most important things every parent should know during the first few months of life. These early weeks are a remarkable period of growth and adjustment for both your baby and you. And we'll begin with one of the most important parts of newborn care, feeding your baby. The first few weeks with a newborn can feel overwhelming, and feeding is often one of the biggest concerns for new parents. How often should your baby feed? How do you know if your baby is getting enough milk? And when should you worry? During the first 6 months, exclusive breastfeeding is recommended for most babies when possible. Breast milk provides nutrition and important immune protection during this early period. But newborn feeding shouldn't be controlled only by the clock. Instead, learn to recognize your baby's hunger cues. Early signs include rooting, opening the mouth, turning the head looking for the breast, bringing hands toward the mouth, and becoming increasingly restless. Crying is usually a later hunger cue. Newborns typically feed frequently, both during the day and at night. Rather than waiting for a strict schedule, responsive feeding means offering a feed when your baby shows signs of hunger. And how long should each feed last? There isn't one perfect number of minutes. Some babies feed efficiently and finish relatively quickly, while others take longer. Watch your baby rather than only watching the clock. Look for active, rhythmic sucking and swallowing. As the feed progresses, your baby may naturally slow down, release the breast, turn away, or become relaxed and satisfied. What about feeding from one breast or both? Allow your baby to feed actively from the first side. When your baby finishes, you can offer the other side. If your baby is still interested, they may continue feeding. There is no need to force exactly equal time on both sides. One of the most common questions parents ask is, how do I know my baby is getting enough milk? Look at the whole picture. Effective feeding, an appropriate number of wet diapers, and satisfactory weight gain are reassuring indicators. Your baby's healthcare professional will monitor growth during routine visits. After feeding, keep your baby comfortable. You can hold your baby upright for a while and burp gently if needed. But remember, not every baby needs to burp after every feed. Small spit-ups are also extremely common in young babies. If your baby remains comfortable, feeds well, and is gaining weight appropriately, occasional small spit-ups are usually not concerning. However, repeated forceful vomiting, green vomit, blood in the vomit, poor feeding, or poor weight gain should be medically assessed. And when your baby is ready to sleep, place them on their back on a firm, flat sleep surface. Avoid letting your baby routinely sleep in an inclined position after feeding. Finally, know the feeding warning signs. Seek medical advice if your newborn repeatedly refuses feeds, struggles significantly with feeding, has noticeably fewer wet diapers, is unusually sleepy or difficult to wake for feeds, or isn't gaining weight appropriately, breathing difficulty, green vomiting, or a baby who appears seriously unwell needs prompt medical attention. Feeding doesn't have to be perfect from day one. You and your baby are learning together. Watch your baby's cues, follow their growth, and ask for help whenever you're concerned. Because good newborn care isn't about following a perfect clock. It's about understanding your baby. And feeding is only one part of keeping your newborn healthy. Next, let's talk about something every new parent needs to know. Safe sleep.